On March 11th, the World Health Organization declared the COVID-19 outbreak a pandemic. Of course, everyone is extremely concerned about what this means for their safety, their family's safety, as well as their furry friends' safety. With me now on FaceTime, I have Scott Weiss. He's the professor at the University of Guelph and the director for Center of Public Health and Zoonoses. Thank you so much for joining me here today.
Hey, thanks for having me.
Thank you. So let's first start with viruses. We know that in general, within the next 4 to 9 weeks, as the temperatures change, this might impact the virus. What is your take on this coronavirus? Do you think we might see a change in how it's reacting? Will it be less potent? What do you think?
Well, it's hard to say. It's not going to be less potent. The virus won't change. The main thing that we'd be looking at for a seasonal effect is how do human behaviors change? Because in winters, we tend to congregate more inside. And our human behaviors are changing a lot right now because of the response to this. The other thing is, does the virus survive differently as it warms up? Viruses sometimes they have different responses to temperature and temperature changes and humidity. So as that changes as we move into spring, it's a potential to have an impact. But this is a very new virus. We didn't know it a few months ago.
Right.
And we're thinking similar to flu and the previous SARS virus, but it's a pure guess what will happen. There's so many things that are happening in how we move and interact and control the virus. It's hard to say whether it's going to change much.
Right. And we know that we can obviously contract it through little droplets from an infected person who might cough or sneeze. So there's a lot of precaution. What are you doing in your day-to-day, and what are you recommending to people that you're coming in contact with for them, first and foremost, to be safe?
Well, a lot of it's common sense, and a lot of it's the same messaging we have for flu and for cold. It's wash your hands. It's clean surfaces regularly. It's stay home when you're sick. If people would stay home when they're sick and cover their coughs, wash their hands, and we're also talking about cutting down hand contact, things like handshaking.
Right.
Some of the social behaviors that we usually do, it's not spread very effectively through the air. It's droplets, like you said, aerosol. So it's in front of someone very close while they're talking or while they're coughing, or they contaminate a surface. So we can do a lot of little things to reduce that risk.
Now, it's also been said that we could be contagious yet not show any signs of the disease. So how do we protect people around us without even knowing that we're contagious? What are some of the recommendations for that?
Well, it's all the common sense stuff, right? So if I have this virus and I'm shedding the virus because I just have a mild infection, or I'm going to get sick tomorrow, but it's starting to brew inside me, it's still things like, washing my hands. So we wash our hands. We usually do it to protect ourselves, but we're also protecting others. So if I have this virus in my mouth and my nose and I touch that, if I wash my hands regularly, I'm going to reduce the risk of me passing it on to someone else. So for the perfectly healthy person, we're trying to, again, reduce that hand contact. That's going to protect us in both directions. And then the moment you feel sick, that we want to step away from people, right? Stay at home. We've got this culture still of, suck it up and go to work because you're sick, because, it's important, or we're important. We overemphasize our importance a lot. Staying at home for a few days can be really problematic for some people and some jobs, but we want to keep them away as much as possible, because those actively sick people are probably the biggest concern. The people that have the virus and don't have disease, they're probably infectious, but it's the people that are actively sick that are probably doing the most transmission.
And what about the children? We hear a lot about kids, again, not maybe even experiencing any symptoms, but still being contagious. They obviously go home or they visit their grandparents. Why do you think smaller kids are not reacting to this virus as much as the elderly?
It's very interesting. The kids don't seem to be as badly affected as influenza. We worry about young kids, and this virus doesn't seem to be doing that as much to the young population, which is really good. Kids are inherently biohazardous. They put their hands in things, they roll around, they're not washing their hands a lot, and we have really close contact with them. If you have kids, you have grandkids, there's going to be a lot of contact with them. And it's the balance, right? We don't want to isolate people so much that they don't have any interaction. But you also want to remember that, okay, grandma's 85 and you've got a kid, well, she's really high risk of getting sick if she gets exposed to this virus. So let's kind of reduce some of that contact. And that's why some nursing homes, long-term care facilities are trying to reduce the amount of contact we're having. So kids probably don't pose more risk just from being a kid. It's the behaviors that they do and the contacts we have with them that are of concern.
Right. So let's shift gears just slightly. So this virus has been reported to have derived from animal, and then that animal transmitting into human. So what is the likelihood of our furry friends or furry family members contracting that disease?
Yeah, we don't know. The big question right now is this a purely human disease or a predominantly human disease? If it's purely human disease, all we need to worry about is people. And
Right.
that's really the best case scenario for us. If it's a predominantly human disease, then we still have to pay some attention to animals. Because
Mm-hmm.
this originated probably in a bat, and then maybe moved into another animal, and then moved into people. And it really likes people.
Right.
And the question is, does it really like some other species? Because most of the testing is done in people because it's an emergency situation. The
Mm-hmm.
resources and the time are going towards people. If you look back to the SARS virus, the original SARS virus, which is very closely related to this one, it could infect some animal species. Cats were one.
Oh,
And
really?
if a cat was experimentally infected, they showed that that cat could then infect another cat. The cats didn't get sick, so it's good for the cats, but they were able to transmit it. So cats are a bit of a concern.
Interesting.
Ferrets could get sick with this virus, they tend to be susceptible to a lot of our respiratory viruses.
Did you say ferrets?
Ferrets, yeah,
Oh, really?
they're more susceptible to those things like our flu than most other species. And then there's a dog in Hong Kong that's tested positive for this over
Really?
a few different positive tests over a few different days. So it looks like it probably has a low level infection. Whether it's infectious is the big question. So if
Mm-hmm.
we look at influenza, so our flu, if I have flu and I cough on my dog or touch my dog's face, I can transmit it to my dog. It's not that common, but it can happen.
Okay.
And because it's not the dog's flu, usually not much happens. They can get sick, but we consider them we call it dead end host. That means they don't pass the virus on. So I can infect the dog. It's not their flu, so they burn it off, and that's the end of it. So with this virus, it's possible, this dog in Hong Kong that's infected got infected from its owner who had an
Okay.
infection, and that's how they would get it. But maybe it's not infected enough to infect anyone else. So we don't know how many animals can get infected, and we don't know if they're infectious, which is the big thing.
Right.
The other thing about animals is just how we interact with them. So if you've got a dog and you've got a person that has a dog or a cat and they're infected, well, we're probably contaminating their hair coat if we're not thinking about it. So if I'm
Mm-hmm.
infected, my cat's sitting on my lap and I'm petting it or I'm coughing around him, even if he doesn't get infected, maybe I've got this virus on his hair coat. So
Yes.
that if I'm doing a good job staying away from everyone else, I'm staying in my house, I'm staying away from my family members, if I'm not thinking about the animal, if I cough on him and then he walks and rubs it against my kid's face, have
Right.
I just done the same thing as me rubbing my hands in my kid's face, which I wouldn't do if I was infected. So since we don't know, we're trying to be cautious without freaking people out. It's just
Right.
think about your dog like your kid, which a
Mm-hmm.
lot of people do anyway.
Yes, they do.
But if you're not going to do something with your kid, let's not do it with your dog. If you're staying inside, let's keep your dog inside. And just remember that if you're infected and your dog needs to go outside, well, it's not a matter of just having someone pick it up and pet it, take it out. We need to think about how we can reduce the risk of that dog being a potential source. It's probably a low risk, but
Right.
while we're trying to really contain this virus, we'd like to if we can do something that's really practical,
Mm-hmm.
we want to try to do those things.
So you're saying that if we have a virus, any virus, the COVID or any other, and we have it on our hand, we pet our dog's fur, it could actually be alive on the fur. For how long? 24 hours?
We don't really know. It's just like a dog could just be like a doorknob or a book or anything
Right.
else we touch. So this virus can probably live for a few days. Like a cat may groom it off fairly quickly, depending where you touch them.
Mm-hmm.
But this virus is probably stable in the environment for at least a little while, hours to days on the hair. But we just don't know because no one's
Right.
looked at it yet. But we know things can survive once they get outside. That's how they get passed on. Just putting on a dog's hair coat may not be a lot different than putting it on any other hand contact surface.
So if we're in self-quarantine, a good idea to also keep your furry friends away from you if you're in self-quarantine, as an
Yeah,
example.
so if you've been exposed and you haven't run into your animal yet,
Mm-hmm.
then we want to keep that animal away. Or if you're on
Right.
a farm, we want to keep you away from your livestock, just so we don't have to worry about that issue.
That's
And
a
if
good
I'm under
point.
self-isolation and my animal's been living with me, so my animal's been exposed to me, well, let's keep him inside, right? I don't
Mm-hmm.
want my cat going outside and rubbing up against
Right.
some other cat that can maybe take it in. We don't know whether there's a real risk there, but if we can do something fairly easy, like just keep your cat inside,
Right.
we might as well do it because then we don't have to worry about it. Because we don't want to have to be thinking about it in our stray cat population or our wildlife populations.
Right. So what are the signs and symptoms that maybe our pets might have if they did contract the COVID? What should we be
That's a good
looking
question.
for?
Yeah, we don't know. And it may be none. So this
Okay.
dog in Hong Kong, it's only one dog, so we can't say much, but it was healthy. and
Okay.
it was positive. Cats with SARS, they were healthy when they were infected. So again, it's good for the cat, but it doesn't let us say, okay, that's me. Cats may be exposed and that one's not. If they do get disease, it'd be very similar to ours. So if we look at influenza, we look at some of the other respiratory viruses, they get what we get. So they might cough, they might have a runny nose, runny eyes, just not feel as good, be a little quiet, not eating as well. So if you have someone that has this virus and their animal starts showing those signs,
Mm-hmm.
it would be on the list of things I'd be worried about. Now, we don't want them to just show up to the vet if they think their cat has this. We want to take some care because we don't want that cat, if it's really infected, to infect the veterinary clinic.
Right.
But I think being aware of that and talking to the veterinarian, saying, okay, I have COVID-19 and my cat started sneezing. What should I do?
Mm-hmm.
And the easy answer might be, okay, if your cat's otherwise stable and healthy, keep it at home, just like you, right? If you're
Right.
not feeling well with this virus, but you're fine, you're not very sick, well, just stay home. We don't want to transmit it. So that's the kind of messaging we're saying. Think about it, but let's be practical. Let's not overreact, and let's talk before we start moving people and moving animals around.
Right. So the short answer is we don't know if cats and dogs could transmit the COVID to humans.
No, we don't know.
Okay.
It's probably fairly low risk from dogs. There's probably more risk from cats, but is there a real risk? We don't know yet.
So is it okay for our dogs to still lick our faces during
If you
this
like
time?
it, it's not my thing. Everyone asks that question, right? So it's for me, it's gross. I don't really like it.
Right.
I don't dissuade people from doing it. Probably if you've been exposed or your dog's been exposed, we don't want that to happen. Young kids, older people, people with wounds, then we don't want them licking that. But if you're an average healthy person, if it's something you like and it's part of your bond with your dog, go for it. It's not for me, so I don't like it, but
Right.
I'm not gonna get upset if my dog licks an otherwise healthy person.
So before you go, what is the one thing you would like to impart on Canada and our audience in terms of the coronavirus, what they should be doing to protect themselves as well as their furry family members?
A lot of it's common sense. And it's the messaging that we've had for years on flu and everything else, but it's, wash your hands, limit contacts, stay home when you're sick, and that will have a big impact. From the animal side, it's just this one health concept. Consider the humans and the animals and the environment together. And for this virus, consider your dog and your cat like your family members. So if we're trying to prevent exposure of family members, let's do the same thing with our animals. If we're worried they've been exposed and we're trying to keep them away from other people, well, let's do the same thing with our animals. It's all fairly straightforward, basic, not too hard to do, and it might have an impact.
Terrific. Thank you so much,
Great.
Scott. That was Scott Weiss, the professor at the University of Guelph. Thank you so much.
Great, thank you.
Thank you.